Do you feel like you practically live in the bathroom, waking up exhausted every morning because you had to get up multiple times during the night and noticing that your urine stream is getting weaker and weaker? If you've been diagnosed with an enlarged prostate but are terrified of surgery or want to avoid the awful side effects of medications, this video is the answer you've been looking for. I'm Dr. Jane, and today I'm going to reveal a practical natural protocol to reduce inflammation in your prostate. We'll cover everything from the double voiding technique to the dietary adjustments most men ignore, but that are essential for relieving bladder pressure and getting rid of that constant discomfort of not being able to fully empty your bladder. Imagine being able to sleep through the entire night again and getting your quality of life back without being completely dependent on the pharmacy. Stay with me until the very end, because in addition to the daily habits, I'm going to give you a list of 4 powerful home remedies that will speed up your recovery, and you can start using them today. Let's get straight to it. To understand why we're making these changes, we first need to know what's happening inside your body. Benign prostatic hyperplasia, BPH, is an extremely common condition. We often say that if you live long enough, you're almost guaranteed to have some degree of prostate enlargement. It's an anatomical reality. This small gland, which in young men is about the size of a walnut, starts to grow and wraps around the urethra, the tube that carries urine out. When it swells, it squeezes that tube like a kinked garden hose. The result? Your bladder has to work incredibly hard to push the urine out, and often it can't empty completely. That creates a vicious cycle. You go to the bathroom, leave, and 10 minutes later feel like you have to go again. The good news is that small, strategic changes in your daily routine can reduce this inflammation and relax the muscles, restoring the flow you've lost. The first pillar of this natural approach is smart hydration. There's a dangerous myth that if you're urinating a lot, you should stop drinking water. That's a huge mistake. When you drastically cut back on water, your urine becomes super concentrated, dark, and full of toxins. That concentrated urine is highly irritating to the bladder lining. An irritated bladder contracts more often, making urgency worse. So the golden rule is drink about 50 to 70 ounces, 1.5 to 2 liters of water per day. It doesn't have to be alkaline or fancy mineral water. Good filtered water is enough. The secret isn't just the amount, but the timing. Start early. Hydrate as soon as you wake up and spread it out through the morning and early afternoon. This helps flush the kidneys, dilute the urine, and reduce irritation in both the bladder and prostate. However, this hydration advice comes with one non-negotiable rule. Our second key point: set a liquid curfew. Try to avoid drinking large amounts of fluid after 5 or 6 p.m. It sounds simple, almost silly, but this is where most patients fail. As we age, our bodies lose some ability to concentrate urine overnight. If you overload the system with water, tea, or juice late in the day, you're basically programming yourself for nocturia, waking up multiple times at night to pee. Broken sleep doesn't just drain your energy, it raises cortisol, the stress hormone, which increases inflammation throughout the body, including the prostate. By cutting off fluids early in the evening, you give your kidneys time to process everything before bed, letting your bladder rest longer and giving you truly restorative sleep. Staying on the topic of what we put into our bodies, we have to talk about a major silent villain: caffeine. The third step to shrinking prostate inflammation is to severely limit or completely eliminate caffeine. Caffeine isn't just a brain stimulant. It's a powerful diuretic and, worse, a direct irritant to the bladder lining. It pulls the trigger on urinary urgency. If you're drinking coffee, black tea, cola, or energy drinks, you're pouring fuel on the fire. For men with an enlarged prostate, caffeine can cause the muscles around the bladder neck to tighten, making it even harder to pass urine. If you can't live without the taste of coffee, switch to decaf, but check labels carefully because some still contain traces. Ideally, keep total caffeine under 200 milligrams a day, about 2 small cups, and only in the morning. And one important detail, don't sweeten with refined sugar because excess glucose is also pro-inflammatory. Use natural sweeteners like stevia if needed. Now we come to a sensitive topic for many guys, but it's essential for prostate health: alcohol and beer in particular. The fourth tip is to cut back dramatically or eliminate alcoholic drinks. Alcohol has a double negative effect. First, it's a diuretic, rapidly increasing urine volume in a bladder that's already struggling to empty. Second, it can cause pelvic congestion. Picture the classic scenario: weekend barbecue, a few beers with the guys, and suddenly your bladder feels full, but nothing comes out. That's called acute urinary retention. Alcohol can temporarily numb the bladder while filling it fast, and the sudden prostate swelling can block everything. This is a painful medical emergency that often ends in the ER with a catheter inserted through the urethra to drain the urine. It's traumatic and invasive, something you want to avoid at all costs. So if you already have BPH symptoms, treat alcohol with extreme caution. Moderation here isn't just general health advice, it's mechanical protection for your urinary system. The fifth step takes us to gut health, something most men never connect to their prostate. You need to increase fiber intake. How are the intestines and prostate related? Simple anatomy. The rectum and colon sit right behind the prostate. If you're constipated, built-up stool stretches that area and pushes forward on the prostate, compressing the urethra even more. Plus, straining to poop puts enormous pressure on the pelvic floor and worsens urinary symptoms. To avoid this internal traffic jam, load your diet with fruits, eaten with the skin, dark, leafy greens, lentils, beans, and nuts. Fiber creates soft, easy-to-pass stool so your bowels move like clockwork. A regularly emptied gut takes physical pressure off the prostate and bladder, instantly improving urine flow and reducing that heavy feeling in the lower abdomen. Now, for a practical technique you can use every time you pee. The sixth tip is to master double voiding. Most guys rush, they pee, the mainstream stops, and they zip up and leave. With an enlarged prostate, the bladder often retains a significant amount of residual urine. That leftover urine is a perfect breeding ground for bacteria, raising the risk of urinary tract infections and bladder stones. The technique is easy. Urinate normally until you think you're done. Then relax. Don't rush. Wait 30 to 60 seconds, take a few deep breaths, and try again without straining or pushing with your abs. Just relax the sphincter. You'll be shocked how much more comes out. This second void ensures you truly empty the bladder, giving you longer intervals between bathroom trips and protecting your kidneys and urinary tract from infection. The seventh tip might bruise a few egos, but it's backed by science. Consider peeing sitting down. When we stand, the leg and pelvic floor muscles stay somewhat tense to maintain posture. For men with prostate obstruction, that tension can prevent full relaxation needed for complete emptying. Studies show that sitting allows greater relaxation of the pelvic and abdominal muscles, resulting in more complete bladder emptying with less pressure. It's also more hygienic and comfortable. While it won't magically shrink your prostate, improving the mechanics of flow and emptying efficiency really helps symptoms. For younger guys watching, adopting this habit early can be preventive, sparing your bladder unnecessary stress over the decades. Now that we've covered lifestyle changes and mechanical habits, as promised, let's talk biochemical support. Nature provides compounds that directly target the inflammatory and hormonal pathways in the prostate. If you've stayed until here, you really want the full solution. So here are the 4 best natural remedies that can be powerful allies when combined with the habits we've discussed. First, and probably most famous, saw palmetto extract, Serenoa repens. This herb is extensively studied and used as first-line treatment across Europe. Saw palmetto works by inhibiting the enzyme 5-alpha reductase, which converts testosterone into dihydrotestosterone DHT. Excess DHT in the prostate tells cells to multiply, causing growth. By lowering DHT, saw palmetto slows prostate enlargement and has strong anti-inflammatory effects, helping reduce swelling and relieve obstruction. Second powerhouse, lycopene, found abundantly in tomatoes, but you can't just eat raw tomatoes in salad. Lycopene is absorbed much better when tomatoes are cooked and paired with healthy fat. Homemade tomato sauce with olive oil or whole tomato juice are excellent choices. Lycopene is a super antioxidant that protects prostate cells from oxidative stress and chronic inflammation. Studies also show it helps protect against prostate cancer. Plus, it's rich in vitamin C, iron, and folic acid, supporting overall immune health. Third, stinging nettle root, Urtica dioica. Often combined with saw palmetto in supplements, nettle has incredible synergy. It's rich in plant sterols and flavonoids that calm inflammation and help regulate how sex hormones bind to prostate cells. The practical result: better urine flow, less residual urine in the bladder, and fewer nighttime trips. You can drink it as tea or, for more precise therapeutic dosing, take standardized capsules. And fourth, pumpkin seeds. These are a true nutritional treasure for men's health. They're one of the richest natural sources of zinc, the mineral most concentrated in the prostate. Adequate zinc is vital for healthy prostate function and preventing uncontrolled cell growth. Pumpkin seeds also contain essential oils and antioxidants that fight inflammation. Eat them raw, lightly roasted as a snack, or ground over salads and fruit. They're an inexpensive, functional food that's easy to add daily and also benefits heart health. Putting all this into practice requires consistency. This isn't a magic pill that fixes everything in 2 hours, it's a new lifestyle. By combining proper hydration at the right times, avoiding irritants like caffeine and alcohol, keeping your bowels moving, fully emptying your bladder, and feeding your body these natural compounds, you create an environment where your prostate can calm down and your bladder can work without stress. Many men significantly reduce symptoms and avoid invasive procedures just by being disciplined. Remember though, BPH is a medical condition. This video is for informational and educational purposes only. It's crucial that you keep regular follow-ups with your urologist to monitor prostate size and rule out other issues. But know this, you have a lot of power to manage your own health. Start today. Pick 1 or 2 habits to change this week, then gradually add the rest. Your sleep, energy, and peace of mind will thank you. If you want more details on preparing these remedies or specific dosages, check the links in the description. And if this video helped you better understand your body, please give it a like and share it with a friend or family member who might be suffering in silence too. Take care and see you in the next video.